Well, hello. I'm Dr. Michael Turner, MD. I'm a specialist in physical medicine and rehabilitation, and I wanted to talk today a little bit about 5 things you should ask your doctor to test you for as far as lab testing. Okay.
All right, so first on the list, vitamin D.
Indeed. Vitamin D, perhaps you've heard of it, extremely important. It's actually not a vitamin, it's a hormone. It got misnamed way back in the early 1900s when it was discovered, but we knew that it was very important even back then. This was the reason that they would take little kids who lived in New York City, outside to get sunshine and stuff, because that sunshine hits their skin and your body can naturally synthesize vitamin D. It was very important for bone health. We knew that early on. People moving to big cities and stuff, especially the children, were getting rickets and having bone problems. So vitamin D has progressed since then in our knowledge of it and our knowledge of how important it is. It doesn't just affect bone health, it also, for example, affects muscle strength, especially the fast twitch, more power generating muscle fibers in our body. If you're deficient for vitamin D for too long, your fast twitch muscle fibers will drop off. There have been interesting studies done in older people where the lower their vitamin D is, the more they're falling, the less power they have to get up safely out of a chair, to even walk across the room, that kind of thing. And when conversely, higher vitamin D levels are associated with less risk of falls and more stability and functionality in older adults. But besides bones, besides muscles, we know it's important for the immune system. We know it's important in risk for autoimmune diseases. So for example, there's a strong connection between low vitamin D and multiple sclerosis. Very important in those cases if you're at risk or if you've been diagnosed to keep your vitamin D levels up. We also know that it's important just for strengthening the immune system.
Okay, the second on the list, it says MTHFR.
Yes, MTHFR is an abbreviation for methylene tetrahydrofolate reductase. And this is an enzyme. It's a genetic test. It can be done through a simple blood test, but it's basically a genetic mutation that exists. This is very important in B vitamin processing in your body, especially folate. So folate is one of the important B vitamins, and it has to be activated. And MTHFR has a crucial role in activating folate. If you don't have enough active folate, you get problems with health of nerves, you get problems with your immune system, you feel fatigued, you don't recover well after injury or illness, amongst other things. You can become depressed. So B vitamins are crucially important, and MTHFR is one of the most important and easily accessible tests that's come along recently for those types of problems.
Great. And then I see DHEA on here.
Yes, DHEA is a hormone. It's been around, our knowledge of it's been around for a while. Kind of in the late 90s, some books were written about it as an anti-aging hormone and the importance of getting it checked. And there's actually quite a lot of credibility to that. Some of the enthusiasm sort of fell off. It was thought to be a fad in some senses, but there's still a strong rationale to get your DHEA level checked. Basically, it's a precursor to other hormones in your body, especially if you're a man. It's a precursor to some of your testosterone and other androgen hormones. It doesn't actually raise the blood levels, but it goes directly to your cells, and within the cell it gets converted to testosterone and some of these other hormones. But besides that, it's important for just overall energy level, again, important for immune system. And interestingly, DHEA has a role in the brain, so it actually acts like a neurotransmitter in your brain, and so it has roles for learning, nerve growth, and mood, even in your brain.
Okay, so I've seen DHEA as a supplement.
Exactly. That's why it started to get a lot of publicity, because they figured out how to synthesize it from a yam, actually. I think they've discovered this yam in Mexico, and so chemically they were able to synthesize DEA. It therefore became available as an over-the-counter supplement, not just a prescription. So there was a lot of consumer-driven health information at that time. So yes, it's inexpensive. You can buy it online, and yet extremely important for health.
What would you suggest? How much should a person be taking?
A great question. I take some of my lead from a doctor, Dr. Rouzier, Rouzier, and he has an anti-aging clinic down in Palm Springs. He gives talks nationally to doctors. You can go for weekends and be trained in sort of his system and methods. And for women, he likes his DHEA up around 200 to 250. For men, around 500. The only reason not to be on DHEA if you're a woman is if you've had an estrogen-related cancer in your past. Because it can increase the estrogen activity in your body. Other than that, it's a great thing to consider and to talk over with your doctor, get your levels checked, and probably get on some supplementation.
Okay, let's talk about Coenzyme Q10.
Yes, Coenzyme Q10, a lot of people have not heard of this. Very important. It's, first of all, involved in the mitochondria in your cell as far as generating energy. So there's a series of chemical reactions that occur down in the mitochondria. Essentially, you're stripping down that fat or that carb into a molecule called acetyl-CoA. That goes through some chemical reactions, and basically in the process of stripping the hydrogens off of this, you end up with oxygen combining with the hydrogen, and you create ATP, which is the form of energy. But coenzyme Q10 has a vital role in something called the electron transport chain, which is the tail end of this process. If you don't have enough coenzyme Q10, your ability to flow smoothly through that process is impaired. And it's also a very strong antioxidant.
Okay, and thyroid.
Yes, your thyroid, you should absolutely get this checked. That would involve 3 labs. One is called TSH, thyroid stimulating hormone. And then thyroid circulates in your body in 2 forms, T3 and T4. You should get each of those checked. So that would be called a free T3 and a free T4 level. Thyroid receptors are all over the place in your body in almost every organ, which is indicative of their widespread role. So for example, symptoms of low thyroid would be low energy, muscle weakness, fatigue, weight gain, constipation, hair falling out, dry skin, memory problems, feeling like you're not sharp mentally. You should certainly get your thyroid checked. Thyroid problems are also fairly common. On the other side, hyperthyroid symptoms would be typically restlessness, insomnia, agitation, unintentional weight loss, feeling hot all the time, again, some muscle weakness. You should get your thyroid checked as well.
Okay, and then we have a couple bonuses.
Sure, I mentioned 5 things, but I want to do a bonus. Here's the 6th for everyone. So this is called CRP, C-reactive protein, and this is a marker of inflammation in your body. In other modules, we've talked about this, but it's not good to have high levels of inflammation that persist in your body. It's a risk for development of cancer, heart problems, neurodegenerative problems. So CRP is a simple blood test that can be done that's quite an accurate measure of inflammation in your body.
Okay, and 1 bonus for males.
Exactly. I'll do a 6th bonus here for the men, which is you should get your testosterone levels checked without a doubt. That would be your free and total testosterone levels. There's, in some senses, you could use the word epidemic. That might be a strong word, but a prevalence of low testosterone among men. It's been documented over the last 10, 30, 20, 30 years that these levels are slowly declining. A lot of thought is that it's related to environmental pollution, such as BPA, if you've heard of that, bisphosphonated A. This interferes with endocrine metabolism. And so, especially in men, it's a real problem. So, a lot of times the guys are, developing a little belly, feeling tired, less pep, some muscle loss, even depression. There's even a strong connection with testosterone and depression and development of Alzheimer's. So it's not just about muscles and it's not just about vanity. It's really overall health and well-being and mental health for men. And so you should certainly get your levels checked.
So if someone has low testosterone, is there anything over the counter? Because we talked about DHEA or...
Correct. DHEA is a part of that. As I said, it won't directly increase your blood testosterone level, but it will go to your cells and get converted there into the testosterone. But probably better, there are some supplements. I think I don't have great confidence in any particular supplement. It's probably going to more be a question of prescription medications. There are several options to help boost testosterone levels.
Okay. All right. Thanks so much, doctor.
Sure.